Good afternoon, my dear students. It's been a long break when I'm talking about this video today. It's almost 8 days that I have not recorded videos. So today we'll talk about the general plan of the hand. Okay. So we'll talk about the hand today. Now, hand meaning the portion here, the distal portion of the upper lip, just in front of the wrist joint. Okay. So now we are going to talk about the hand in response in relation to the muscles of the hand, the nerve supply of the hand, and the importance of the hand in actions. Okay. So when you are going to talk about the hand, you should know that the hand has two basic parts. This is called as the palmar aspect of the hand, and this is called as the dorsum of the hand. Okay, so palmar aspect of the hand, which is the palm, and the dorsum of the hand. These are the two parts of the hand which you need to know about. Okay, now when you talk about the palm, we'll talk mainly about the palm, and the palm has muscles which are small muscles of the hand, and these muscles are 20 in number. So there are 20 muscles in the hand. Okay, now how are these 20 muscles arranged? You have 4 muscles in 5 groups. Okay, you have 4 muscles in 5 groups, so the total muscles which come are the 20 muscles. Okay, now which are these groups? You will have thenar muscles, you will have hypothenar muscles, then you will have lumbricals, you will have palmar interossi, and you will have dorsal interossi. Okay, so each of these are these are 4 muscles in 5 groups. You will have 4 thenar, 4 hypothenar, 4 lumbricals, 4 palmar interossi, and 4 dorsal interossi. Okay, we'll talk about the nerve supply of these muscles, the names of the muscles, and the important actions of the muscles, and the related ocular anatomy of these muscles. Okay, so first we'll know the names of the muscles. Okay, you should know the names of the muscles of the thenar eminence and the hypothenar eminence, because the lumbricals and interossi don't have any other names. Okay, so what are the thenar eminence muscles? Now thenar eminence is the eminence which is present here. The eminence which is present below the thumb is called as thenar eminence. Now thumb meaning polishes. So the muscles which are there here will come with the name of polishes. So which are those polishes? The muscles which abduct the thumb, you will have abductor polishes, then you will have adductor polishes, then you will have flexor brevis, and you will have opponens polishes. Okay, so what are the muscles here in the thenar eminence? You will have abductor polishes, adductor polishes, flexor polishes, and opponens polishes. Now, abductor polishes, meaning if this is the thumb, the movements of the thumb which are there, you will see. See, this will be adduction, this will be abduction. So the muscle, the movement of the thumb towards the midline, adduction, abduction. This is flexion, this is extension. Okay, so understand these movements. So adduction, abduction, flexion, extension, and this will be opposition. Okay, the distal phalanx of the thumb touching the distal phalanges of the other fingers, this is called as opposition. So the muscle which is going to produce abduction, meaning if this is adduction, this is abduction, this will be produced by abductor polishes brevis. Okay, it's a small muscle, so it can be called brevis also. Then adductor polishes, this is the muscle which is going to do adduction. Then you will have flexor polishes brevis, this is going to do flexion, and you will have opponens polishes. Okay, so these are the 4 thenar eminence muscles. Now what is the importance of these muscles? These muscles are going to do movements of the thumb, as I told you. Okay, we'll talk about the nerve supply and action, nerve supply later. Okay, so these are thenar eminence muscles. Okay, now the next group of muscles which are called, as hypothenar eminence. Okay, now hypothenar eminence, where is this hypothenar eminence? This is the portion which is there below the little finger, and this is called the hypothenar eminence. Okay, now here the little finger is called digiti minimi. Okay, so what are the muscles here? You will have flexor digiti minimi brevis, opponens digiti minimi, opponens digiti minimi. Then you will have palmaris brevis, and you will have abductor digiti minimi. Okay, so you will have flexor digiti minimi brevis. Okay, then you will have opponens digiti minimi. This action, the little finger taking to the distal phalanx of the little finger caught to the distal phalanx of the thumb. This is opponens digiti minimi. Palmaris brevis is a small muscle which is going to tense the skin of the palm, and abductor digiti minimi. This is going to take the thumb away from the midline. That is abductor digiti minimi. Okay, so these are the 4 hypothenar muscles. Okay. Now, next group of muscles you will have what? You will have lumbricals. Now this is very interesting to understand. Okay. Now lumbricals, or some people call them lumbricals also. These muscles are here. Okay. You will have the muscles. These muscles are there in the center of the palm. And very importantly, you should understand that these muscles arise from the tendon of flexor digitorum profundus. Now flexor digitorum profundus is the deep flexor of the forearm. Everybody knows that. When the tendons of flexor digitorum profundus are passing through the hand, the flexors, the first tendon of flexor digitorum profundus will give origin to the first lumbrical, second lumbrical, third lumbrical, and fourth lumbrical. So this is how the origin of the lumbricals is. The lumbricals are the muscles which are going to arise from the tendon of flexor digitorum profundus. That is what you should understand, and that is the origin. And these lumbricals are going to be inserted here at the back. Lumbricals and interossei also, which are going to come later, they are going to be inserted back into the dorsal digital expansion of the back of every finger. Okay, so this is about lumbricals. I would request all of you to please go and read this properly to the textbook, because I am just giving a skeleton of the hand. Okay, details of this origin insertion you will read through the textbooks properly. I am just giving you an idea so that you will have a gross idea which is going to be useful for you throughout life. So this is the origin of lumbricals. And then the last group of muscles, you will have the interossei. Now interossei, you will have 4 palmar interossei, and you will have 4 dorsal interossei. Okay, so 4 palmar interossei meaning inter meaning between, okay, and ossei meaning bones. So in between these bones, meaning the metacarpal bones, you will have the origin of these interossei. So on the palmar side you will have 4 muscles, and on the dorsal side you will have 4 muscles. Okay, so this is this muscle what you are seeing here. This is the first dorsal interossei, and similarly there will be muscles on the palmar side. So if you draw the metacarpals like this, 1, 2, 3, 4, 5. You will have palmar interossei here on this side, and the dorsal interossei will be on the other side. What you have to understand, the dorsal interossei is here, the first dorsal interossei is here, the second dorsal interossei is here, the third and the fourth. Okay, so the dorsal interossei will be on the opposite side. Okay, so I hope you have understood this. And as I told you, the dorsal interossei and palmar interossei, both of them along with the lumbricals, are inserted here at the back of the each finger, where that is called as the dorsal digital expansion of the finger, where these muscles are inserted. Okay, so that is about these muscles. Now, as we have talked of the actions of the thenar eminence and the hypothenar eminence, you should know the actions of the lumbricals and the interossei. Okay, now lumbricals, as I told you, these are the small muscles which are going to be here. The action of the lumbricals is this. You have to demonstrate the action like this. What do? They will flex the metacarpophalangeal joint. These are the metacarpal, these are the phalanges. They will flex this joint and they will extend interphalangeal joint. So that is the action of lumbricals. Okay. So what is the action of lumbricals? The lumbricals are going to flex metacarpophalangeal joint and they are going to extend interphalangeal joint. Okay. So that is the action. Now action of the interossei. Now there are 2 types of interossei. I told you palmar interossei and you will have dorsal interossei. Okay. So what you will remember the action? You will remember the action as PAD and DAB, meaning palmar interossei adduct and dorsal interossei abduct the fingers. Meaning if you have these 4 fingers here, these are the 4 fingers, the axis of abduction and adduction will pass through the middle of the middle finger. Okay, so the axis of abduction and adduction will pass through the middle of the middle finger. So anything that goes away from this will be abduction. that anything that comes closer to this will be adduction. So palmar interossi will adduct and dorsal interossi will abduct. Okay. So this is the action of the palmar interossi and dorsal interossi. Now coming to the most important aspect of these muscles is the nerve supply. Now you have to please be very careful while understanding this. The nerve supply of these muscles is very important. Now you know that there are 20 muscles here in the hand. Of these 20 muscles, 15 muscles are supplied by the deep branch of ulnar nerve. Deep branch of ulnar nerve. Okay, and only 5 muscles are supplied by median nerve. Okay, so the ulnar nerve is the main nerve which is going to supply majority of the muscles of the hand. 15 muscles are supplied by deep branch of ulnar nerve and 5 muscles are supplied by median nerve. Now if we will understand what is simple first. Okay, so 5 muscles which are going to be there. Here, out of the 4 lumbricals, the 4 lumbricals which you saw were abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and so out of these 4, the thenar eminence muscles, only 3 muscles are supplied by the median nerve. Adductor pollicis, which is a muscle of the thenar eminence, is supplied by the deep branch of ulnar nerve, and the adductor pollicis is said to be the graveyard of the ulnar nerve. So these are the 3 muscles, and you will have first and second lumbrical, which are going to be supplied by the median nerve. Okay, so these are the 5 muscles, meaning 3 muscles of the thenar eminence and first and second lumbrical are supplied by the median nerve. Now you should understand why first and second lumbrical are supplied by the median nerve, because lumbricals are small muscles which are going to arise from flexor digitorum profundus, and because flexor digitorum profundus has a dual nerve supply, meaning lateral half of flexor digitorum profundus is supplied by median nerve and medial half of flexor digitorum profundus is supplied by ulnar nerve. So first and second lumbrical are supplied by median nerve and third and fourth lumbricals are supplied by ulnar nerve. Okay, so I will repeat again. What are the muscles supplied by the median nerve? You will have abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and first and second lumbrical. All other muscles, meaning which are the other muscles remaining now, which are supplied by the ulnar nerve? 15 muscles which are supplied by the ulnar nerve. Which are these? We will have 4 hypothenar muscles. You will have 4 hypothenar muscles. Then you will have third and fourth lumbrical. Third and fourth lumbrical. Then you will have 4 palmar interossi. 4 palmar interossi, and you will have 4 dorsal interossi. Okay, so these are the muscles which are going to be supplied by ulnar nerve. So 4 3s are 12 and 3 15. So we have not seen that 15 muscles are supplied by the deep branch of ulnar nerve. I hope this is clear how the plan of the hand is, where these muscles are. I am again requesting you to please go through your books, read the table which is given of origin, insertion, nerve supply of these muscles. I have given you a gross skeleton of how to understand the hand, which are the muscles in the hand, and what is the importance of these muscles. Okay, so this is the video, a short video on the hand. I request all of you to please watch this video to the end. Please put your comments and please like and subscribe my channel. Thank you.